country, and I'm excited about it. Our speaker has made it abundantly clear that there may be a lot of people to blame, but it won't be her committee people. It won't be those of us who have jurisdictions. There's nothing that we would rather do than be able to say that we help for you to fulfill not just a campaign obligation, but a moral obligation. We all are indebted. And so, Senator Kennedy, this is a fantastic day. There hasn't been a time we haven't hoped that we could do this. And so we know that there's going to be a lot of problems. But we also know what you've created is a group of missionaries to make our political job easier, so that when we have the problems, they won't have to say, what are they doing in Congress? They can go to our union leaders, our business people, our advocate for children, those that do want public program, and at least we would know that we're moving in the direction which our country wants us to do collectively. So I'm proud to be on the team.
Good, thank you. Is your counterpart on your committee here?
Yes, he is. Dave and
Come on,
I
Dave.
work so closely together. If we can keep the disagreements down, we'll be a hell of a team.
Well, what I meant, Charlie, was let's give him the mic.
It's tough in the minority, let me tell you.
Go ahead, Dave.
You do lose a microphone when you're not in the majority. But thank you, Mr. President.
Yeah.
Thank you so much for bringing us all together. I think much of what has been said I can agree with, and I think particularly the idea that we have an American solution. Mm-hmm. And certainly in America, the idea that a patient and physician make the healthcare decisions that affect them is certainly something we need to protect.
Right.
And I just appreciate the opportunity to be here. Look forward to working with you. There's so many things that we talked about that we had in common in terms of health information, technology, wellness. But we are going to have to figure out, just how much of our economy is devoted to health care. I mean, that's going to be a big issue we have to face.
Right.
And this cost shifting that goes on between public and private healthcare dimensions, and those are challenging things, but I look forward to working with you and your team on this.
Well, you raise a couple of important points. Number one, doctors, and I'm assuming that we've got somebody, and I'm going to call on them in a second, but I've got a lot of very close friends who are doctors, and the enormous pressure and strain that the medical profession is now feeling from a whole variety of sources is something that we've got to attend to in this reform process. We're not producing enough primary care physicians because the costs of medical education are so high that people feel that they've got to specialize. The issue of malpractice insurance is real, and if you're an OB-GYN, that is enormous pressure that you're having to deal with. One of the things that we've done in this budget that we're presenting is to finally surface what had been the fiction that we weren't going to give doctors higher reimbursements. We always did it in the end, we just didn't budget for it, and it caused enormous stress for them. Now, the flip side of it is if we're going to do more for doctors, part of what we've also got to say is if there are states like Minnesota that are providing as good or better care than other states and yet are keeping their costs lower, and Medicare and Medicaid reimbursements are better controlled, shouldn't we be learning from what those states are doing and then making that more generally applicable? And there may be some resistance on the part of providers to say, well, our circumstances are different in this state or that state, but this is what I mean when I say that data and evidence have to drive the process. If we can find better practices, then doctors have to be willing to learn from the experience of others in terms of controlling costs. They've got to be part of the solution as well. So since I'm talking about doctors, we've got Ted Epperly of the American Academy of Family